Our state's seen more than 900 new COVID-19 cases over the past 24 hours. Doctors and health leaders all across the state, including Dr. Scott Harris, the state's health officer, keeping a very close eye on those rising numbers.
Dr. Harris joins us live this afternoon for an update on the coronavirus cases and the impact it's having on our state. Good evening, or good afternoon, I should say. Thanks so much for joining us.
Good afternoon. Thank you for having me.
So you heard the numbers that Ian just mentioned. Well, we've had about 3,000 cases across the state since Friday. We want to begin with how concerning those numbers are to you.
These numbers are very concerning to us. What we're seeing are increasing numbers of community transmission cases throughout the state. We have seen cases throughout the state over the past few months, and sometimes we see more activity in one area than another, and to some degree that's still the case. But all parts of the state really are seeing significant numbers, or at least significantly more than they've had in the past. We have been recently rolling out a risk dashboard that's color coded for people to understand the colors or the risk in their particular county. And I have to tell you, there's a lot of red and orange on that map that we don't really like.
Dr. Harris, you said last week that if people don't comply with health orders, they can only go so far. So do these latest numbers tell you that people aren't doing their part when it comes to slowing the spread?
I think we're certainly concerned that some people are not. I know that many people are. There are many Alabamians that have done a terrific job in protecting themselves and protecting others and paying attention to the guidance that we're trying to get out there. And yet it's very clear if you just go outside and around your city at all, you can see that there's some cases where people are not doing that.
We know that wearing a mask or face covering has been a bit controversial in Alabama. What do you want to say to people who just refuse to wear a mask?
I mean, ultimately, the reason to wear a mask is because you care about people around you. You know, it's really unfortunate that it somehow turned into a partisan political statement. I don't know how we, got to this point, but it's very clear that wearing a mask prevents people from transmitting disease to others. And we know that maybe a third or more of people who are infected and capable of infecting others may not even know that they're sick. They may not have symptoms at all. So wearing a face covering is just the polite thing to do. It's the right thing to do, and it shows that you care about those people that you're around.
With that in mind, we've seen some counties, Jefferson County included, moving toward a countywide face mask mandate. Is that something statewide we should be looking at that is on the table and being discussed?
I think a statewide face covering mandate would save people's lives. I think it would prevent disease transmission. I think it would be a great idea. At the same time, it's very clear that we have to have the support of people at the local level to do that. Putting in place a health order that people don't respect or unwilling to follow is not going to be helpful. So we are working very hard with people in different parts of the state to try to educate them, to help them understand the importance of supporting this. We already have face covering mandates or health orders or other types of ordinances in place in many parts of the state, including Birmingham, Mobile, Montgomery, as of tomorrow in Madison County and Huntsville as well, also in Tuscaloosa. So most of our large population centers have adopted this. We hope that others will do the same.
Dr. Scott Harris, Alabama State Health Officer, we appreciate your time this afternoon talking with us and updating us on COVID-19 here in the state.
Great. Thank you for having me.